Welcome back to the DNA Pest Control Podcast. Like promised, I have a special guest on the podcast today, and he's going to be back a few more times. So get ready for that. His name is Chandler Larson. He is a partner with the Benefit Tools. Okay, they're out of Salt Lake City. He has an undergrad from the U. He is licensed in multiple states. But the Benefit Tools, where he is a partner, they specialize in health benefits as well as financial benefits and everything like that. So let me get him on here. All right, Chance, you there? Oh, Chance, are you there?
Yes. Can you hear me?
I can. Okay, so a few technical difficulties. All right, so today we're going to talk about health insurance. And the main reason why I'm even bringing up health insurance into the DNA Pest Control Podcast is I have a lot of people here that are working here. I have family who's brought stuff up. And a lot of people don't understand it on a personal level. What is health insurance? They think once they get health insurance, it's just free. They get to go to the hospital and everything's okay. So Chance, what are the different types of plans with health insurance?
Great question. So out in the world of health insurance, there's really three different plans, and they always just go by the abbreviation. So there's HMO, PPO, and EPO are the three most common types you'll hear. And an HMO stands for a health maintenance organization, and I don't expect you to remember that. But basically, an HMO is the cheapest type of insurance. A good example is in California, you have Kaiser Permanente, where they basically say, you need to go to our hospitals and our doctors.
Now,
and so the advantage for the health insurance company is it keeps costs down because they force you to go to their doctors and their hospitals.
Now, are they willing to pay, let's say I am out of the state of California and Kaiser is not there, will they typically cover outside of the state?
Great question. So insurance, all plans by law will cover you for emergencies. But what I always tell my clients is, what's an emergency to you is not necessarily an emergency to the health insurance company. A great example with this is I had an individual that was visiting his brother down in Texas, and he suffered a massive heart attack. So obviously, heart attack, that should be covered, right?
Yeah, I'd say so.
So he goes to the emergency room, they stabilize him, and he was on an HMO based out of Utah. So he's stabilized, they cover all of that, but then the doctors tell him in Texas that he's going to need 4 stents put in his heart. So what happens is the doctors, back with his health insurance company out of Utah, said, you know what, we think he'll be fine to make it all the way back to Utah to get those stents put in his heart. You stabilize him, we think he'll make it. The doctors in Texas said, he's going to die if you send him back to Utah. So he decided to have the stents put in his heart down in Texas, and then we had to fight with the insurance companies because they denied the $240,000 claim for the stents being put in.
Whoa. Okay. So good and bad.
good and bad, but you will be covered anywhere. Now, there are some HMO plans where they can offer out-of-network coverage, but as a general rule, the hard and fast rule is if you're on an HMO, you need to go to your doctors and hospitals that are in your network.
Gotcha. Okay. Now, what about a PPO?
So a PPO is another acronym that stands for a Preferred Provider Organization. Now, the PPOs of the three basic types of plans are the most expensive. What that means is you can go to a doctor in network or out of network. We don't care. But if you go to the doctors that are in our network, it's going to be cheaper for you. If you go out of network, you're going to pay more. But it gives you total flexibility.
Oh, okay. And then that's the same with EPO.
So not quite. So an EPO, which stands for Exclusive Provider Organization, it's a less common type of plan. You don't see them as much, but an EPO is basically the same as an HMO. It's just a larger network.
Okay.
So what happens with that is it still has, you need to go to our doctors, but we have a much larger network than the HMOs typically. You usually see EPOs with larger companies.
Okay. Now, so we'll talk about an HSA, because I don't think a lot of people know about this either.
Sure. So in the world of your plan, when you have an employee or just an individual that's looking for health insurance, there's really two options that you have, two paths you can go down. One is a copay plan. And a copay plan is your traditional insurance. This is what you think of when you think of insurance, which is, you know what, my son has an ear infection. I need to take him to the doctor. I go to the doctor and I pay a copay, hence the name, of say $35, and the doctor treats my son and I'm done.
Yeah,
that's
so
kind of traditional insurance.
That's like what I grew up on. So we'd go to the doctor, we pay $20. That was the copay. They check us out, whatever. I broke my arm. I paid $20, I think. I mean, I don't know what happened after that, but it was $20 I had to pay to go see the doctor.
Exactly. And then typically with copay plans, you pay that. Same thing with the prescription drug side. So if you need to go get some prescription drugs, if it's a generic, you pay $2. If it's a preferred generic, you pay $5. Preferred brand, it increases as you go up on the tier of the drug. But that's kind of traditional insurance, copay plans.
Yeah.
Now, to answer your question with an HSA, the HSA stands for a health savings account. So with my background being a finance guy, I love the HSA. In fact, whenever I sit down with an individual, I always kind of push them towards an HSA, with the exception of a few examples, and I'll kind of go over that. But an HSA is a different concept, and they haven't been around for as long. They've been around for about 15 years now. And what an HSA is you have to have what's called a high deductible health insurance plan. So what that means is, and I'll kind of explain what a deductible is, but instead of on your copay plan, let's say your deductible is $3,000, okay? Mm-hmm. An HSA deductible may be $7,000. And a lot of people say, wow, that's a lot of money. But what it does is by having that health insurance plan, you can have an HSA account. And an HSA account is a bank account. It's administered by a national bank. And that bank gives you the option, if you're an individual, to put $3,600 a year in the account, or if it's you and at least one dependent on the health insurance, you can put up to $7,200 per year in. Now, the reason why I am such a big proponent of HSA plans is it is the only triple tax advantage that I know of in the investment world. The money you put in the account, Go ahead.
No, I was going to say, so what do you mean by the triple tax benefit?
Yeah, so if you think of like a retirement plan, right? So let's say you have a 401k. You put money in and you don't pay taxes on the money that goes in it. Well, where's your taxable income? Well, the money's in the account, and then you invest that money and it grows. And then when the money comes out, you pay taxes on the money when it comes out. That's traditional 401k. Mm-hmm. With an HSA, you can put the money in tax-free, so you don't pay taxes on that money. Then you invest that money so it can grow. And most HSA plans, a big company in the country that does these is Health Equity. And Health Equity, once you have at least $2,000 in your account, you can invest in no-load mutual funds that are great investments. And all the money in that account grows without you paying taxes on all those capital gains. Mm-hmm. And then if you use that money for any health expenses, you never pay taxes on that money or the interest you earned in the account.
Wow. So now so I understand it a little bit better. So a copay, you're traditional. You have your HSA, which is now you have an account that once you get enough money into it, you can turn it into an investment account, which then will pay for your health care with what's in it. But now when it comes to the HMO, PPO, EPO, do I have a choice between, can I do an HMO that's a copay or an HSA connected to it? Or do I have to, so I can do that?
Great question. So the PPO, HMO, EPO is based on your insurance company and the plans they're providing. But within that, you can pick. So whether you have an HMO, a PPO, or EPO, within each one of those, you can choose either a copay or an HSA plan.
Okay. So if I'm an individual, and I'll just throw this out there for the technicians, managers, operators, if your company's not providing you with this health insurance and you have to go out and choose your own plan, this is something that you guys would want to look at. This is something that you would go through and say, okay, which plan would work best for me and my family? Which it sounds like.
Absolutely.
Yeah. So it sounds like the HSA obviously is going to come up to the top because you can dump so much money into it, which then in return isn't getting taxed, which goes right back into paying for your health care. You just have to be consistent on saving.
And your monthly premiums are usually less. So what I tell people is with the HSA plan, you get to, let's say, I'll give you an example. I met with an individual last week, and the cost difference between an HSA versus a copay plan was about $200 a month. So what I told him is I said, take the HSA plan and put that $200 you'd be paying on the copay in the bank account and let it grow. And the other thing that's important to note is it's not just medical expenses. It's dental, braces. You can use that for the HSA. You can use any prescription drugs, contacts, LASIK eye surgery, all of those things. You know, my wife, she likes to buy these creams and stuff. All of that can be used out of your HSA account. It's not just going to the doctor.
Same with like Tylenol, Advil, NyQuil.
Yep.
Okay, so any medical anything, I guess, that you could get, you could actually use this account, which is already tax-free, to buy those things.
Mm-hmm.
So you're getting more.
Exactly right. And
so your dollar's going a lot
and
farther.
You'll never pay taxes on that money, so it's great. Now, just like everything in life, there's a trade-off. So the downside to an HSA is, I give the example of my son earlier, right? Needing to go to the doctor. Well, here's a true story. I have a small son, and I always know when he has an ear infection. I should have an MD because every time I can tell he has an ear infection. So on a copay plan, I could take him to the doctor and I'd pay $50 and the doctor would take care of him and it's done. So on an HSA plan, you pay all of the cost until you meet your deductible. So to give you an example, I have a $6,900 deductible on my HSA plan that I'm on. With him going to the doctor for an ear infection, I get a bill for the total cost of the doctor. So instead of paying $50, I get a bill for $140 for the doctor visit. But the insurance company will then reprice it for me because I went in network, and so they lowered it from 140 down to 85. So I had to pay $85 for that visit. Now, some may say, well, geez, I just paid $85. If I was on a copay plan, I would have paid $50. Well, for me to be on that same copay plan, it would have cost me an extra $290 a month.
So that's where you're saving.
So you're saving the money there, and typically the plans usually are better for what I always tell people is an HSA plan is better for people that never go to the doctor. If you're never going to the doctor, you're saving so much money each month to be on that rather than a copay plan.
Yeah.
The other option is for people that go to the doctor a ton. An HSA is always a better option than a copay. The only time copays are better is kind of that middle ground where, well, I go to the doctor every 2 months for whatever reoccurring condition I have. or I take a
Okay.
lot of prescription drugs. That's where a copay plan can be better. But I would just run a cost analysis on any plan I'm looking at.
Yeah. So then that kind of brings us to the next point. So if I'm looking at a plan, so I did a little example online at, what was it called? Healthcare.gov or whatever.
Yeah.
I think, yeah. So I went on there, I threw in there 34 years old, making 40,000 a year, just me. I found a plan on there that was $159, I think it was. And this was actually with a tax subsidy, which we'll actually get into
Yes,
right
we'll
after
talk
this.
about those. Yeah.
But so I was going to pay about $160 for me, with how much I was making and everything. And that was the deductible was $8,550. It was an HMO. And then also the max out of pocket was $8,550. Now, would that be considered an HSA or is that a copay? Or would that include in the
Great
copay?
question. So that's actually neither, believe it or not. The example you gave is kind of a trick question here.
Oh, okay.
So what happens is that is definitely a high deductible, right? That's a lot of money.
Yeah.
I mean, not many people have $8,500 lying around.
No.
But what happens is just because it's a high deductible plan does not mean it's an HSA plan. So if you go to a website like healthcare.gov, which is known as the marketplace, you can pick plans, but you need to make sure it says HSA. So on the example you gave, you basically get that repricing that we talked about with an HSA plan, but you don't get the benefit of having the bank account.
So they won't even let me get the bank account.
No.
But I'm also not
an HSA qualified plan, but you also don't get the copays either. So that's kind of you probably pulled up, they call those more catastrophic plans. So those are kind of a different misnomer. It's kind of a category of its own. But I'll give you an example. When I look at healthcare plans, you were on the right path with the deductible and the max out of pocket. I review a lot of health insurance plans, and a lot of people get really caught up in the copays or the co-insurance and things like that. The first thing I look at when I'm looking at a health insurance plan is the max out of pocket. That to me is the most important thing with health insurance.
Yeah.
So
and
example,
why is that? Why is that? Because I mean, for these guys, and they'll know what I'm talking about. When I'm walking up to a house, I know exactly where I'm looking for certain insects, or I'm looking for certain things, rodents. I can pick that stuff out right away. You ask someone else who doesn't do what we do, they don't see that. They don't even know what to look for. So why would you look directly? Oh, I mean, that's exactly why I'm calling you about the health insurance, because I don't know what I'm looking for. So why would you say max out of pocket? Why is that where you're looking first?
Great question. So with health insurance plans, and there's a lot of terminology that they use in the health insurance industry, and a lot of it is just confusing. So let me kind of take a step back and define some of these things. So for example, a deductible, okay? The deductible is the total amount of money you need to pay before your co-insurance kicks in, okay? And I'll explain co-insurance. So to give you an example, let's say I'm on a copay plan and I have a $2,000 deductible, and I have an $8,000 max out of pocket, and I have a 20% co-insurance, okay?
Yeah.
So this is a copay plan. So if I go to the doctor, I just pay a copay, right?
Yeah.
We've established that. But let's say something big happens. Let's say I break my leg.
Yeah.
And I have to go to the emergency room, and I have to get my leg set, and I have all these things in physical therapy and whatnot. I have to pay that $2,000 before I get coverage. So I have to meet that deductible. The deductible is the total amount of money you have to pay before you get coverage on bigger items, more than just seeing a specialist, basically surgeries, pregnancies, basically anything that's a big ticket item. Okay? So I have to pay the $2,000, and let's say the total cost of my surgery for fixing my broken bone is $12,000, okay? I would have to pay the first $2,000. That means there's $10,000 less that needs to be paid. And if I have 20% coinsurance, I will pay 20% of the cost until I reach my max out of pocket, which is $8,000 in this example. And I know this is hard to follow if you're not seeing it in front of you, but basically the way to think of it is if I broke, my arm, my leg, whatever, and I have a $2,000 deductible, an $8,000 max out of pocket, and a 20% coinsurance, the total cost to me on that plan for $12,000 would be $4,000 that I would have to pay.
So now with that, so we pay $4,000. Our max out, what did you say the max out of pocket was?
$8,000. So you paid $4,000 out of the $8,000. So you're halfway there.
Okay. So, and that's for one broken leg. Let's say I am running around the house and I trip and I land on a ladder and I break my ribs and I have to go back in, and that all happened the same year.
Uh-huh. And let's say, and you mentioned a good thing, same year. Okay. That's a great point. So health insurance plans are based on a calendar year basis. So January 1st to December 31st. So in your example, let's say you break your ribs, and let's say there's other complications, and it ends up costing $50,000, okay? And you've already paid $4,000, and your max out of pocket's $8,000. The most you will ever pay in a calendar year is $8,000.
So then I would have to pay my $2,000 deductible again, right?
So you've already paid your deductible, so you don't have to pay it again.
Okay, so deductible's done.
You only pay that once.
Yeah, but now there's a 20% copay or coinsurance. So off of that $50,000, I'm paying $10,000, but I'm not, because I only can get max out is $8,000. So I'm only paying $4,000 of that $10,000 that I'm supposed to owe. But since my max out of pocket's $8,000, it stops at that. So I only will pay the total.
That's exactly right.
Okay.
So, and that's why for me, the most important thing I look at when I examine any plan and read a benefit summary, the most important thing is the total max out of pocket, because if I have a terrible year, that is my biggest liability. I had an individual where his son got cancer, a poor little kid, and the medical bills were over $700,000 in a year.
Oh my gosh.
Unfortunately, health insurance is crazy expensive. It's terrible. So if in our example, the most you would pay of that $700,000 is $8,000.
Wow.
And that's why a lot of people, when they have years that they have surgeries or children born, it'll be like, hey, I've already met my max out of pocket. Let's add every other possible thing I can, because it's all covered 100%. Prescription drugs.
Oh, so
everything.
Once you hit that max out of pocket, you're not even paying the copay for prescription drugs after that.
Nope, covered 100%.
Oh, okay. See, I didn't know that. I didn't know that once you hit that max out of pocket, even the copays get completely wiped.
Yep. Once you hit the max out of pocket, you don't pay another dime towards anything with your health insurance.
So in all reality, I mean, obviously you'd go in depth on certain plans, but main thing is you want to see, okay, my max out of pocket is going to be $8,000. That will fit into my budget, especially if I can use an HSA, because then it's all tax free.
And a lot of HSA plans have the same deductible as they do max out of pocket. So oftentimes, in my example where I have a $6,900, that's my deductible and my max out of pocket.
Oh, okay. So then you're done.
So I pay everything until I hit $6,900. So last year, my wife had a baby, right? I maxed out. I paid the full $6,900, but after that, I didn't have to pay anything else. So my wife toyed with getting her meniscus that was torn fixed and getting that done. And then there were all these things, because once we had met it, it's like, let's get everything done. Yeah.
So I guess a little tip for everybody. So let's say you, well, it's kind of a bad example because we're kind of beginning of year, but if you jumped onto a new company or you're joining insurance at the end of the year in November, and you're going to hit your max out of pocket or whatever, go get everything done as fast as you can to get that, out of the way. Or even now, I guess, if you had an accident and you're hitting that max
the
out of
beginning
pocket.
of year is the best time to get it. Yeah.
Yeah, no.
The worst is when it's the end of the year, because then you get hit paying some of it, and then if there's rollover into January, this all resets.
Yeah, I was thinking of dental. But we're not talking about that because I had that situation. But no, you're right. And I guess that is good to talk about, because if you do have that rollover, so if you break your leg in November, but you need surgery and they schedule it in January, you're getting dinged. Right?
Yeah, that's exactly right, because it all restarts first of the year.
So if you have anything happen at the end of the year, make sure they take care of it before December 31st.
The end of the year, or hold out to the next year.
Or don't get it fixed until January 1 comes around.
Exactly. It'll save you a bunch of money.
Oh man. So now let's talk about it. So that's more of just generalized plans. That's if you have your own plan. Some companies, this is something that guys will have to look for. You guys work for, bigger companies. They have insurance plans for you. I guess look at those, see what they're offering, see what the max out of pocket is. Because I know in some cases you don't really get a choice. I mean, they choose the plan and then you're just stuck with it, right?
Yeah. So most companies, most employers I see, they can offer 3 to 5 plans depending on the insurance carrier. But some employers say we're only going to offer one plan. It's a little more rare these days. You usually see multiple plans being offered, but typically they'll usually give you at least one copay and one HSA. A lot of companies will give you a few different plans you can choose from, and unfortunately, most of the time it's, "Hey, Bill, what plan did you pick?" "Okay, I'll take that one."
Oh, God. Yeah.
And they don't really go through this.
Yeah. Well, so now these guys know what to look out for, especially when it comes to how much are you willing to spend in that calendar year. So now let's talk about it, because I know it's kind of lingered on, and with change in presidents and things like that, it kind of was all funky, and I think everybody's kind of up in the air about fines. So with Obama, you had fines if you didn't have insurance. Then Trump came in and said, "Okay, we're not going to look at that anymore, and it doesn't matter if you have insurance or not. We're not going to fine you." So where does that sit on a personal level? Where does that sit on a company level?
Great question, and this is a good segue into kind of the subsidies that you can get as an individual. But what happens is the individual mandate that came about with the ACA, the Affordable Care Act, which was the Obamacare, as everyone knows it, required you to have health insurance. And if you didn't, the government would fine you up to $680 a year. And then President Trump came in and got rid of what President Obama did, got rid of the individual mandate. Ironically, there's still the corporate mandate. So if you have over 50 employees, the company will still get penalized every year per employee up to $2,700 an employee. But for an individual, you don't have to have health insurance anymore. You're not required to get that. It's up to you. Now we'll see, now that President Biden's in, if he'll bring back the individual mandate and force everyone to have health insurance.
And that is state to state. So anybody who listens in and is in California, we are mandated to have it. And I think there's an $800 fine per person if you do not have it. So, I mean, obviously check your state, but yeah. So on a federal level,
so the Fed, that's exactly right. Federal level's gone, but each state has the right to kind of do what they want.
Yeah. So then that comes down to the next thing. So I'm a guy who works for a company that offers insurance. I don't like his plans. I want to go get my own plan, and I hear about these subsidies. So I can get a healthcare plan for cheaper than what my employer will give it to me, right? What happens?
Happens all the time because oftentimes healthcare is expensive.
Yeah. Oh, yeah.
Employers have to pay a lot of money, and they try and pass a lot of the cost on the employees. And so it's really enticing when you go into the marketplace, and usually it's healthcare.gov, but different states, for example, you just mentioned California. California, they have their own Medi-Cal, so they use their own kind of market for it. But basically, you have the option to go look at plans and to get subsidies, and you see, wow, I can get these great plans that are dirt cheap because the government's paying for it. The problem is, if your employer offers you health insurance and you decide to get a subsidy, and in the subsidy, in the format as you're completing it online, you have to designate and attest that you do not have the option for health insurance through your employer. So what happens is, if I take that subsidy and the government's paying a large portion of it, employers are required to report to the federal government if they offer health insurance. Mm-hmm. And if it gets matched up that you were offered a plan that you said you weren't, and you got that subsidy, the federal government will make you pay back that entire subsidy. So I've seen people at the end of the year get hit with thousands of dollars of penalties.
Yeah. Well, so I have an example. My secretary just went through that. She went on I think it was Medi-Cal or something. And I didn't know that at the time if you got offered it or anything like that, but she ended up getting fined, which I'm assuming that's exactly what happened. She ended up getting fined thousands of dollars because she thought she was getting health insurance for free. Come to find out, that's not how that worked. And she got hit with everything at the end of the year.
Yes. Now, the other possibility that could have happened to her is when you fill this out online, your entire subsidy amount is based off your income. Mm-hmm. So I've seen a lot of people say, well, I'm making $100,000 a year for my wife and my two children, but if I claim I'm only making $60,000 a year, which aside from that being illegal and you're on government forms lying about it,
yeah.
What happens at the end of the year is you claimed you were making $60,000, but you really made $100,000. The government will make you pay back the difference.
Well, so now this question is actually for her because we just were talking because she just went into surgery. So she actually just had surgery done. And we were talking beforehand how she hates the insurance company that she's with. Hates them. Uh-huh. Because I'm assuming it's an HMO because she can only go to this one doctor.
Must be. Mm-hmm.
And so I was talking to her, and it's through her husband, where her husband's working, and that's how she's on this plan. But she absolutely hates it. So now, in her situation, I am not offering it to her. So would she get a subsidy for that? If she wanted
great question.
to get off of her husband's insurance and get her own?
So that brings up a really interesting question, and there's a couple of factors here. Okay, so one is how they file their taxes. I'm assuming they file a joint tax return. Most married couples do.
Yeah, jointly, yep.
And so what happens is the answer is no. She can't get a subsidy because her husband is offered health insurance, and therefore she is offered health insurance. Now, there are some exceptions. There are some nuances to that, and we're not going to go into that because that could take another hour just going through the details. So the basic answer is no, but there are exceptions. So that's a case-by-case example.
Gotcha, okay. Well, yeah, because I was getting excited finding out about this because then I could tell her, hey, you can actually cut this guy off. You don't have to go see that doctor for, because she's getting another surgery done with the same guy. But in this case, it's not worth it.
Yeah, I tell you what, we'll talk one-on-one after this and get a little more detail and see if there's an opportunity for her.
Yeah. Oh, yeah. No, I'm sure she would be really interested in it because they do not get along. So... And I wouldn't want to be, I wouldn't want to get put under with a guy that I just pissed off. So
No, it makes you wonder what they're doing when you're not around.
Well, yeah. So, I mean, it actually,
You're not conscious, I guess.
you have no idea what they're doing. So not fun at all. So now the other thing is so, okay, so I'm working for a company. I'm with them. I have their plan, and then suddenly they fire me, or I end up quitting,
Mm-hmm.
or lose, whatever happens. What happens to my health insurance in that case? I just lose it. I got to go figure it out, or what comes up?
Great question. So you have some options. So one option is you can get on Medicaid. You can go and try and apply for Medicaid. And Medicaid is for those that are low income, kind of the poor, it's to help them. The other option is, let's say you love your plan. So let's say it's the opposite of your secretary's problem. You love the doctors, you love the health insurance, it's a great plan. There's an option called COBRA. Mm-hmm. And COBRA is offered to you if your employer had, or has, I guess, present tense, more than 20 employees. They are required by law to send you paperwork to elect COBRA, which is a continuation of the benefits that you had on the health insurance. Now, the difference is most employers pay a portion of the health insurance. With COBRA, you're paying 100% of the bill, and they usually, depends on the employer, tack on a 2% fee on top of it that you have to pay.
Okay, but at least you can still be insured, even though
you're
not working there.
You can stay on the exact same insurance, even though you're not working there, for up to 18 months. Now, some states like California, they have some continuation that can extend it up to 36 months, but it depends on circumstances. But the typical rule of thumb for the federal law is you have 18 months, a year and a half.
Oh, okay. So you mentioned I can either, at that time, I can go to Medicaid. Or Medicaid. Okay. So now what's the difference between Medicaid and Medicare?
Good question. So Medicaid is for the poor. It's a state by state program. Mm-hmm. So the Medicaid in, say, Nevada is different than Arizona versus California because it's all based on the state. Okay. So Medicaid, typically you qualify for that if you make less than, for example, in the state of Utah, it's like, they just expanded it, but previously it was up to 130% of the federal poverty line. So each state, Medicaid is based on your income. If it's below that, you qualify for Medicaid. Now, Medicare is for individuals when they turn 65 and older, or if they're considered disabled. If you're considered disabled, you qualify to enroll in Medicare. And that brings up another good point, which is if you're turning 65 and you work for a company with less than 20 employees, let's say you love your insurance plan, your employer pays 90% of the cost, it's great. If you're turning 65 and your employer has less than 20 employees, you are required by law to enroll in Medicare. It doesn't matter.
So you don't even have an option or anything. You just have to.
You have to enroll in Medicare. Now you have to enroll in Medicare, and you don't have a choice about that. Now you can, if your employer has more than 20 employees, you can stay on the employer plan and defer your Part A and Part B of Medicare.
For how long?
Oftentimes as long as you want.
Oh, okay.
You can defer Part A and Part B. And the reason why somebody would defer is Medicare used to be completely free, but then the government started running out of money. And so what they did is they said, well, Part B, we're going to put a premium on it. And it's a tax. They're taxing you. So Part B, there's a premium you have to pay each month, and it's based on how much your income was when you worked. Mm-hmm. And that premium you have to pay for your Medicare. But in a lot of cases, Medicare is a better option than your employer plan.
Yeah, well, so it sounds like, because you're not paying any co-pays, you're not paying anything like that with it. You're just paying that premium, and that's it.
Well, no.
Oh.
So, and that may be a deep dive into that. So Medicare, Part A, hospitalizations are covered. Part B is outpatient services, and it will cover, Medicare pays about 80% of the cost. And that's a rough thing because there's different deductibles, but they pay about 80% of the cost. But what most people do is they either get a Medicare supplement or a Medicare Advantage plan that goes with that. But that's a whole nother book to open.
Oh yeah. Okay. Well, I mean, we're not going to get too in depth with it. So I think we covered the main basics of, health insurance, the different plans, deductibles, max out of pocket, what to look for. Is there anything else you'd want to add and let these guys know? Industry secret, anything like that?
So the one big advice I would make is, if your employer doesn't offer health insurance, the marketplace plans are a great option based upon your income. And it's not only based on your income, it's based on how many children you have. So those are the two factors, your income and then the number of dependents on your plan. So it kind of surprises me. I've seen several people that go and they get health insurance because their employer doesn't offer it, because most of them work for small employers. But their health insurance, they're paying the full cost. And I've said to them, well, your income, you qualify for a subsidy of $400 a month. How would you like to knock $400 off your bill? And they're just kind of stunned by that. So it's always something that you should look into, and it's just on healthcare.gov. But I would definitely look at that if your employer is not offering you health insurance.
So that's an awesome tip. Always make sure you're checking up on that and seeing. So the marketplace is, I'm assuming, kind of the lingo for it. The website is healthcare.gov, and that's where they can find it.
And then it does depend on the state you're in. Some states use healthcare.gov, but there's others that don't. California is one that does not.
Yeah.
So you would use Medi-Cal.
Yeah. Yep. And I've been on that website for Medi-Cal. So state by state, healthcare.gov, I guess go check, or just type in Google. I'm sure you could easily Google it and find out where that marketplace is for you to be able to check those prices and make sure you're putting in all the correct information, because you could get dinged at the end of the year if you don't put in that information.
Mm-hmm.
So, well, thank you so much, Chance, for being on the podcast and, just telling us everything about health insurance. There's a ton of stuff. I mean, and we talk all the time, and I have no idea some of these things that I just learned today. So thank you so much for coming on and just letting us know exactly what to look for when it does come to health insurance personally. And even if we're working for somebody, our employer is, providing it, definitely check out the plans that they offer. So thank you so much.
Absolutely. Happy to help.
All right. You have a good one.
You too.
So there you go, guys. You have it. You have all the information that you need for health insurance. It is super important, to check that out. And I hope this helped you out. And if you have any questions specific to it, he is going to be back on the podcast. We have so much more to talk about with him. I will answer all those questions then. Make sure that you email or get on Instagram and let me know the questions you have for him. But thank you so much for listening in, and we will talk to you guys another day. Thank you.